Now it's time for you to mix your Sermorelin Forte Plus. In order to get ready to do so, please gather an orange-capped insulin syringe, a 3 milliliter mixing syringe, have some alcohol swabs available. You're going to need a new bacteriostatic water, your vial of Sermorelin Forte Plus, and a sharps container. In order to start the process to mix your Sermorelin Forte Plus, go ahead and take your bacteriostatic water out of the protective vial, along with the Sermorelin Forte Plus as well. You'll see that each vial has a protective cap right on the top. Go ahead and place your thumb on that protective cap to pop it off to remove. Do so on both the bacteriostatic water and the Sermorelin Forte Plus as well. In order to move on to the next step, you want to grab an alcohol swab and make sure that you sterilize the top of each vial. So with the alcohol swab, please go ahead and rub off the rubber gasket which is on top of the cap on both the water and the Sermorelin Forte Plus. Next, you want to take your mixing needle and clockwise give the protective sheath a twist. You want to make sure that the needle is on tight. We always want to equalize the air pressure which is going into the vial. So in this case, for this patient was prescribed 6 milliliters of bacteriostatic water into the powder. So what we're going to do is go ahead and pull the plunger back all the way to 3 milliliters of air. Put that needle into the bacteriostatic water, push the air into the vial, and then invert it. At this point, go ahead and pull slowly on the plunger, and you'll see that the syringe is filling with water. Do so nice and slowly to avoid any excess air bubbles. You will notice that when you get towards the bottom, there is a little air pocket that gets stuck at the top. So if you go just below the 3 milliliter and then push it back up, you'll see that the air gets completely pushed out. Ensure that you're at the 3 milliliter mark, invert it, and remove the needle from the water. When you put the needle into the Sermorelin Forte Plus to go ahead and start mixing, you're going to see that there's a negative air suction that's within that vial. If you go ahead and put that into the rubber gasket, it's going to try to suck the water out of the syringe. Make sure you're holding the needle in a way so that you control the plunger. You want to point the needle towards the inside edge of the glass into the Sermorelin and let the water run down the glass into the powder. Take your time doing this very slowly. Let the water run in. Once the Sermorelin's full, we want to go ahead and repeat the first step that we did. We need another 3 milliliters. Just like before, go ahead and pull the plunger back to the 3 milliliter mark. Put it into the water. Push in the air. Invert. And withdraw another full 3 milliliters. Again, there's a little bit of air bubble at the top. I push the plunger up to get that air out, and then go right back down to the full 3 milliliters. Invert, and just like before, control the plunger, put it into the powder, aim towards the edge of the glass, and very gently let the water run down the side of the glass into the solution. Go ahead and sit the needle down momentarily, because what we want to do is gently swirl the water around the inside of the vial to make sure that all of the powder is mixed properly. We want to do so by holding it parallel with the ground and place the glass vial between the palms of your hands. Gently roll it back and forth, swirling the water around so that it hits all parts of the powder, the top of the vial, and the sides as well. This can take anywhere from 60 seconds to a full 2 minutes. Be patient with it. You want to make sure that when you're done, you have a nice clear solution. Now that that's complete, you'll see that there's no more powder, and you have a nice clear solution. What we want to do at this point is equalize the negative air pressure which is on the inside of the vial. So what you want to do is take that mixing needle and very carefully grab the protective sheath. Put that sheath over the needle, and clockwise, we're going to go ahead and take that needle off of the syringe. With this needle, for about 3 seconds, just poke it through the top of the rubber gasket, and you're going to hear the air pressure escape. Go ahead and throw that dirty needle into the sharps container, and now you can dispose of the plastic syringe, the caps, the alcohol swabs, and put those off to the side. We're now prepared to do the Sermorelin Forte Plus injection. Again, take an alcohol swab, and you always want to clean off the top of the vial before any mixing, before any injection, to ensure that everything is sterile. This is also a subcutaneous injection, which means it goes in the fat of the skin of the belly area. One of the best places for this is 4 to 5 inches to the left or to the right of the navel area. So while you have the alcohol swab, go ahead and clean off the injection site where you want to do your injection. Now, on the container that the Sermorelin Forte Plus comes in, you'll see that there's the doctor's instructions, your name, prescription, and dosage. In this case, the patient was recommended 200 micrograms, which is the 20 mark on the insulin syringe. Go ahead and take your insulin syringe and remove the protective caps on both ends. Just like with the mixing, you always want to equalize the air pressure. So you're going to go ahead and pull the plunger back to the 20 mark. Go ahead and insert the needle through the rubber gaskets, push in the air, invert the vial and the needle so it's pointing towards the sky, and slowly pull back to the 20 mark. Sometimes you'll see that there's a little bit of an air bubble stuck at the top. You can pull back to approximately the 25 and then push the plunger back up to the 20, which you'll see pushes the air completely out of the syringe. Invert it, and now you're ready for your injection. Hold the needle as if you were throwing a dart. Put the needle up to the skin where you cleaned off with the alcohol swab. Quickly push the needle into the belly area, push in the plunger, remove, and you're complete. Go ahead and dispose of your needle into the sharps container. You want to take your vial of Sermorelin and place that back into the protective pill container which it came in. You always want to keep it in this case for several reasons. One, this contains your prescription with your dosage and the mixing instructions, so you can always refer back to that. But also, in case you drop it, you don't want that glass vial to shatter. This also serves as a protective coating. This Sermorelin Forte Plus, after being reconstituted, will always be refrigerated. So go ahead and put this in the refrigerator. One of the better places is in the top of the fridge back behind the milk. We highly recommend not to put it on the refrigerator door because when opening and closing, it'd be very easy for it to fly off and the possibility of breakage.